Some of the wounds were 7 inches deep. You penetrated lungs, liver, head, and heart. What? What? Hello everyone, and welcome back to Lindsay Unfiltered. And today we will be going over and reading the entirety of Dee Dee Blanchard's autopsy report. Some of my subscribers let me know that this has been unsealed. I don't know how long this has been out. Some people said they leaked it. You know, they like to say things have been leaked, things have been released. But I have seen some videos lately come out about this, and I was able to get a copy of the full autopsy report thanks to someone on Facebook. And I'm going to read it word for word so you don't have to. Okay, guys? I have not read this. There may be words in here that I don't know the definition to, so if we need to look up a few definitions, we will. And this is a 17-page document, so buckle in. This one may be a long one. And if you like true crime, scandals, conspiracies, with a touch of humor, this might be just the channel for you. So go ahead and hit that subscribe button. Make sure to hit the bell so you are aware each and every time I drop a video. So, without further ado, let's read this autopsy report. I have to thank Shiree Jane for posting this. It's in one of the Facebook groups I'm in. Whoever put it up said, thanks Shiree Jane. So thanks Shiree Jane. And there was another person that I'm talking to on Facebook that's giving me little pieces of information. I want to thank that person as well. Her name is Tess Roberts. I was looking for this report for a few days now, and Tess kind of led me in the right direction. So I want to thank Tess Roberts as well for helping me out with that. It was really nice of her to help me out with that, because this was not easy to find for the first couple of days until somebody was like, you know what, just drop it. I'm not going to gatekeep. I'm going to just drop it. Today is a lazy day, and we're going to be reading this to the best of our ability, guys. Today, I woke up, I was like, I was not feeling the greatest, but work shall continue. All right, without further ado, let's start. Final diagnoses of the post-mortem examination of the body of Claudine Blanchard. 1. Investigation to date reports that Miss Claudine Blanchard was found lying prone in her bed at her residence. Miss Claudine Blanchard was pronounced dead at the scene at 3:13 p.m. on June 14th, 2015. Now, we know that's days after Gypsy and Nick had committed the act, right? I think about it, they call the movie The Act, right? And the act was really this act, right? All right, number 2, medical history of asthma, GERD, acid reflux, thyroid disease, diabetes, headache, hyperlipidemia, and endometrial cancer. The only thing I don't know on that list is hyperlipidemia. Surgical history of hernia repair, appendectomy, tonsillectomy, hysterectomy, and cholecystectomy. Now, a hernia repair, she had a hernia, appendectomy, appendix removal, tonsillectomy, tonsil removal, hysterectomy, uterus removal, and cholecystectomy is gallbladder removal. How do I know that? I've had a cholecystectomy. Gallstones are no joke, guys. Autopsy findings of multiple stab wounds and multiple incised wounds. Now, incised wounds, when we're talking about wounds, I am not a doctor. I am not a post-mortem examination expert, but from what they're saying is stabbing would be like a poke. An incision would be like a cut, right? When you go to a surgeon and they do surgery on you, they incise you. They cut you like this. They don't poke you like that, right? So V is toxicology, non-contributory. Like basically saying what's in her blood, what drugs she's on. All right, so opinion. It is in my opinion that Claudine Blanchard, a 48-year-old white female, died of injuries of the neck, back, chest, and abdomen due to multiple 17 stab wounds and multiple incised wounds. Those are the slits, right? Her manner of death is ruled a homicide, meaning someone unalived her. Now we go to post-mortem examination of the body of Claudine Blanchard. On June 15, 2015, at the Greene County Medical Examiner's Office in Springfield, Missouri, a post-mortem examination was performed on the body of Claudine Blanchard, an adult female. The autopsy was performed under the authority of Missouri state law. The examination was conducted by medical examiner Jeff Harkey, MD, assisted by Tom Vandenberg of the medical examiner's office, and was begun at 12:50 p.m. Prior to her death, Miss Claudine Blanchard had lived with her daughter in a residence in Springfield, Missouri. After their neighbors reported to the Greene County Sheriff's Office that both women were missing, a search warrant was obtained and deputies entered the Blanchard residence on June 14, 2015. Miss Claudine Blanchard was laying prone in her bed. Prone, I'm assuming, right? There were obvious signs of death. No resuscitation efforts were begun. Miss Claudine Blanchard was pronounced dead at the scene at 3:13 p.m. on June 14, 2015. The Greene County Medical Examiner's death investigator was called to the scene and reported that Claudine had incised wounds of the neck and multiple stab wounds of the back and torso. Medical records dated June 2nd, 2015 indicated that the descendant had a past medical history of asthma, GERD, acid reflux, which is terrible, thyroid disease, diabetes, headache, hyperlipidemia, and endometrial cancer. She had a surgical history of hernia repair, appendectomy, tonsillectomy, hysterectomy, and cholecystectomy. Her prescription medications were not listed in the medical record. It was reported that medications at the scene were collected by the Greene County Sheriff's Office. Now we need to look at the general observations. The body was received in a body bag that was secured with tamper-evident seal, and that was marked with the descendant's identifying information. The descendant is Dee Dee in this case. A medical examiner's identification tag was on the left ankle. I think I saw that in the photos as well. The body was that of a well-developed, obese, white female whose appearance was consistent with the given age of 48 years. The body measured 5 feet 2 inches in length and weighed 255 pounds. The body was received clothed in a white nightshirt with a floral print. There were multiple cuts on the upper back of the nightshirt, and these defects corresponded to the positions of the stab wounds on the back of the descendant's body. The upper front of the nightshirt was bloody, as was all the back of the nightshirt. There was a religious pendant on a string necklace. That was about the neck. Cuts in the necklace responded to cuts on the back of the descendant's neck. Now, again, we go with the religious necklace, or the religious pendant. I feel like there was a lot of religious imagery inside of Dee Dee and Gypsy's house. She had a religious pendant on. She had religious things all around the house. God Bless America at the front door. Pictures of angels on the wall. Pictures of the Pope on the wall. Gypsy had crosses on her wall. So God was involved in somebody's life in that house at some point. I just don't know what happened. I don't know what happened for God to be involved and then a death like this to happen, you know? I just don't know. Okay? Paper evidence bags were in place over the hands. Prior to the further examination of the body, the fingernails were clipped and collected. Oral swabs, vaginal swabs, and rectal swabs were collected. Combed pubic hair and pulled pubic hair was collected, and pulled head hair was collected. The clothing, as well as all of the items of trace evidence, were taken into evidence by the Greene County Sheriff's Police. Any evidence of medical resuscitation intervention? None. Evidence of injury. This is where we have to hone in and pay attention, right? There were 17 stab wounds. We know this, right? Everybody says she was stabbed 17 times. It's his job to tell us where, how deep, etc. For purposes of description, the stab wounds are numbered 1 through 17. The numbering is arbitrary and not intended to indicate the order in which the wounds were received. So it's not like 1 was done first, 2 was done second. It's arbitrary. It's just showing what the medical examiner is saying. It's not like 1 was the first one, 2 was the second one. They probably don't know the order, but they're labeling each one, right? Upper and middle back, 13 stab wounds. Behind the top of the left shoulder, oriented longitudinally, 1 inch on the skin surface. Center of the wound, 8.5 inches below the top of the head, and 4 5/8 inches to the left of the posterior midline of the body. Now, guys, there is a drawing. There is a drawing on the last page. So if you guys don't understand what I'm saying, because I honestly don't understand what I'm saying, I'm not an expert. I'm going to show you guys the picture that kind of coordinates with what this is saying. Sharp upper end and sharp lower end. Wound direction is back to front. Wound track is 3 1/8 inches deep, passes through skin, fat, and muscle, ends on the posterior surface of a left upper rib. Center of the upper back, oriented somewhat transversely, 5/8 inch on the skin surface. Center of the wound is 11 1/4 inches below the top of the head and 5/8 inches to the left of the posterior midline of the body. Sharp left superlateral end and sharp infero-medial end. Wound direction is back to front. Wound tract is 1 1/2 inches deep, passes through skin, fat, and muscle. 3. Left side of the upper back, oriented obliquely, 1 3/4 inches on the skin surface. Center of the wound is 1 1/2 inches below the top of the head and 4 3/4 inches to the left of the posterior midline of the body. Sharp left superlateral end and sharp infero-medial end. Wound direction is back to front, left to right, and downward. Wound track is 5 inches deep through skin, fat, and muscle of the chest wall to where it penetrates into the left chest through the muscles of the third left intercostal space, perforates the upper edge of the lower lobe of the left lung at the oblique fissure, then perforates the inferior portion of the lower lobe of the left lung, perforates the posterior wall of the pericardial sac. That has something to do with the heart. We're going to have to look up pericardial sac. I'm going to put it down here. Perforates the posterior wall of the left atrium of the heart next to the mitral valve. Stabbed in the heart. That's what it looks like to me. Can somebody clear it up? Stabbed in the lung and in the heart. Absolutely brutal. 4. Center of the upper back, oriented somewhat longitudinally, 7/8 inch on the skin surface. Center of the wound is 11 1/2 inches below the top of the head and 5/8 inches to the right of the posterior midline of the body. Blunt upper end and sharp lower end. Wound direction is back to front. Wound track is 1 1/4 inches deep, passes through skin, fat, and muscle. Now again, center of the upper back, that's the 5th one, oriented obliquely, 1 inch on the skin surface. Center of the wound is 13 inches below the top of the head and 3/4 inches to the right of the posterior midline of the body. Sharp left superomedial end and blunt inferolateral end. Wound direction is back to front, slightly left to right and downward. Wound track is 2 to 3/4 inches deep as it passes through skin, fat, and muscle of the chest wall. Enters into the right pleural cavity through the muscles of the right fifth intercostal space to the spine, from where the wound track continues for another 3 inches, perforates the lower lobe of the right lung. Wound is 5/8 inch in length on the posterior surface and 1/4 inch in length on the anterior surface, then perforates the right side of the diaphragm and then penetrates into the posterior portion of the right lobe of the liver. And we have an entire page. We have another page. It looks like over unaliving. What do you say? What do you say? I'm going to read it all so you guys can just see the magnitude of what happened here. I'm going to read every single bit of it, right? 6, center of the upper back, oriented somewhat longitudinally, 1/5/8 inch on the skin surface. Center of the wound is 13 1/4 inches below the top of the head and 1 3/4 inches to the right of the posterior midline of the body. Sharp left superomedial end and blunt inferolateral end. Wound direction is back to front and downward. Wound track is 2.5 inches deep as it passes through skin, fat, and muscle of the chest wall. Enters into the right pleural cavity through the muscles of the right sixth intercostal space next to the spine, from where the wound track continues for another 1 1/2 inches as it penetrates into the posterior lower lobe of the right lung. Center of the middle back has 2 components, making it somewhat L-shaped. Longitudinal portion is 3/4 inch on the skin surface, and transverse portion is 1/2 inch on the skin surface. Center of the wound is 16 1/4 inches below the top of the head and 2 5/8 inches to the right of the posterior midline of the body. Sharp at both ends. Wound direction is back to front. Wound track is 1 3/4 inches deep as it passes through skin, fat, and muscle of the chest wall. Enters into the right pleural cavity through the muscles of the right ninth intercostal space next to the spine, from where the wound track continues for another 1/8 inch as it penetrates into the posterior surface of the lower lobe of the right lung. Right side of the upper back, oriented longitudinally, 1 3/4 inch on the skin surface. Center of the wound is 9.5 inches below the top of the head and 3.5 inches to the right of the posterior midline of the body. Sharp upper end and blunt lower end. Wound direction is back to front, right to left, and downward. Wound track is 4.5 inches deep, passes through skin, fat, and muscle. This is ridiculous. This is ridiculous. This is ridiculous. Like, what? Imagine this doctor just sitting there with a ruler, having to do all of this, and thinking in his head, what the heck happened there? What the heck happened there? How could this happen? And we're only on 8? We're only on 8? All right, we're going to keep going. 9, right side of the upper back, oriented obliquely, 1 1/8 inch on the skin surface. Center of the wound is 11 1/4 inches below the top of the head and 3.5 inches to the right of the posterior midline of the body. Sharp left supermedial end and sharp infralateral end. And it continues. Wound direction is back to front and slightly left to right. Wound track is 4.5 inches deep, passes through skin, fat, and muscle. 10, right side of the upper back, oriented obliquely, 1 1/4 inch on the skin surface. Center of the wound is 10 3/8 inches below the top of the head and 4 5/8 inches to the right of the posterior midline of the body. Sharp left superomedial end and sharp inferolateral end. Wound direction is back to front, left to right, and downwards. Wound track is 5 1/2 inches deep. Passes through skin, fat, and muscle. These are deep. 11. Right side of the upper back, oriented obliquely. 1 1/8 inch on the skin surface. Center of the wound is 9 1/2 inches below the top of the head and 5 1/2 inches to the right of the posterior midline of the body. Sharp left superomedial end and sharp inferolateral end. Center of the wound is 9 1/2 inches below the top of the head and 5 1/2 inches to the right of the posterior midline of the body. Sharp left superomedial end and sharp inferolateral end. Wound direction is back to front, right to left, and downward. Wound track is 3 inches deep, passes through skin, fat, and muscle. Right side of the middle back. Number 12. Oriented obliquely, 1 inch on the skin surface. Center of the wound is 15 5/8 inches below the top of the head and 6 1/4 inches to the right of the posterior midline of the body. Sharp left superomedial end and sharp inferolateral end. Wound direction is back to front. Wound track is at least 7 inches deep. Perforate the skin, fat, and muscle of the body wall. Penetrates into the right chest cavity. Penetrates 1/4 inch into the posterior surface of the lower lobe of the lung. Do you know how deep 7 inches is? Do you know what 7 inches is? I'm looking around for something 7 inches. I don't even know if that's 7 inches, but far right side of the upper back is 13, superior to the right axilla. Oriented longitudinally, 3/4 inch on the skin surface. Center of the wound is 9 inches below the top of the head and 9 3/4 inches to the right of the posterior midline of the body. Sharp upper end and sharp lower end. Wound direction is back to front and slightly right to left. Wound track is 4 1/4 inches deep, passes through skin, fat, and muscle. Now we go right chest, where there's 2 stab wounds on the right chest. There was one on the right axillary line, oriented nearly transversely, 1 1/2 inch on the skin surface. The center of the wound is 17 inches below the top of the head and 9 inches to the right of the posterior midline of the body. Sharp posterior end and sharp anterior end. The wound direction is right to left. The wound tract 4 1/4 inches deep as it passed through skin, fat, and muscle of the body wall. The wound tract then continued another 3 inches as it passed through the lower recess of the right pleural cavity, then perforates the lower lobe of the right lung, then perforates through the lateral end of the diaphragm, and then penetrates into the right lobe of the liver. 15 is the right supraclavicular area, and that one is oriented obliquely, 1/2 inch on the skin surface. The center of the wound is 8 1/2 inches below the top of the head and 2 1/2 inches to the right of the anterior midline of the body. Sharp left superolateral end and sharp inferomedial end. The wound direction is downward. The wound tract is 1 1/2 inches deep, passes through skin, fat, and muscle. And here is an additional side note. In association with the 6 stab wounds that perforated into the chest, wounds 3, 5, 6, 7, 12, and 14, there were 250 milliliters of blood and clots in the right chest cavity, 500 milliliters of blood and clots in the left chest cavity, and there were 100 milliliters of blood and clots in the pericardial cavity. In association with the 2 stab wounds that continued throughout the diaphragm and into the liver, wounds 5 and 14, there was a trace amount of blood about the liver and the peritoneal cavity. The neck, 2 stab wounds, 16 and 17. 16, back of the neck at the base of the skull, oriented transversely, 3/8 inch on the skin surface. Center of the wound is 6 inches below the top of the head and 3/4 inch to the right of the posterior midline of the body. Sharp left medial end and sharp lateral end. Wound direction is back to front. Wound track is 2 inches deep. Passes through skin, fat, and muscle. Right side of the back of the neck at the base of the skull is 17. Oriented transversely, 1 1/2 inch on the skin surface. Center of the wound is 6 inches below the top of the head and 2 3/4 inches to the right of the posterior midline of the body. So this is all part of his job. He has to get exact measurements of where everything is in relation to her head, her chest, her lungs, her liver. To most people, we wouldn't make much sense of this, right? We can read it and kind of understand that some of these were deep, some of these were passed through skin, fat, and muscle. There was blood associated pooling up in the body, and the manner of death corresponding to these cuts was very, very brutal. To put it short, to put what I just read short, I just read it to go through the facts that we have here that are completely harrowing and completely awful. Oh, and there's more. For cut 17, sharp left medial end and sharp lateral end. Wound direction is downward. Wound track is 3 1/4 inches deep. Passes through skin, fat, and muscle. There were multiple incised wounds, which are the ones, the slits, right, on the neck, and there was one incised wound on the left hand. Transversely across the back of the neck at 7 inches below the top of the head. The wound is 7 1/8 inch in length and penetrates up to 3 inches into the soft tissues of the neck to end the space in between the spinous processes of cervical vertebrae 6 and 7. B. Transversely on the left side of the back of the neck at 6 inches below the top of the head. The wound is 3/4 inch in length and is superficial, a scratch. C. Obliquely on the right side of the neck, inferior to the lower jaw. On the skin surface, the wound is 4 1/4 inches. The center of the wound is 6 1/2 inches below the top of the head and is 4 1/2 inches to the right of the posterior midline of the neck. The anterior end of the wound is forked, indicating that the 4 1/4 inch wound had been produced by at least 2 cutting motions. The wounds penetrate 3 1/4 inches into the soft tissues of the neck to end on the right side of the cervical spine. D. Transversely on the right side of the neck, there are multiple long, parallel, superficial cuts. The center of the cluster of cuts is 7 3/4 inches below the top of the head and is 4 3/4 inches to the right of the posterior midline of the neck. E. On the left hand, there is a superficial cut 3/8 inch in length. The cut is on the radial side of the dorsal aspect of the 4th digit. So these are all talking about the slits, not really the stabs, but the slits here. Now let's talk about the external examination. The body was cool and is in an early state of decomposition characterized by the passing of rigor mortis, drying of the fingertips, darkening of the skin of the face, and skin slippage on the face and upper chest. Fixed lividity was present anteriorly. The scalp hair was light brown and was short. The ear lobes were cosmetically pierced. There were bloody fluids on the face, in the nose, and in the mouth. Could that have been from her being stabbed? Maybe. The ears and nose were otherwise unremarkable. The eyes had white sclerae and injected conjunctivae. Cloudy corneas obscured the irides. The neck was obese and had no discernible masses. The thorax was symmetrical. There was a post-mortem puncture wound in the upper right quadrant of the abdomen. A post-mortem puncture wound, which means a puncture wound after she'd passed away. Am I wrong in saying that? There was a scar from her gallbladder being removed, 6 inches in length along the right costal margin. There was a transverse 5-inch scar across the lower abdomen. The abdomen was obese. The external genitalia were those of a normal adult female. There was a tattoo on the left side of the back. There were tattoos on the lateral sides of the lower parts of the leg. There was a 6.5-inch longitudinal scar on the back of the lower part of the left leg. The extremities and back had no significant deformities or other abnormalities. There was nail polish on the fingernails and the toenails. Internal examination. The autopsy was performed utilizing a Y-shaped thoraco-abdominal incision and a posterior coronal scalp incision. All of the viscera were cool, except for the apparently remote surgical absence of the appendix, gallbladder, uterus, ovaries, and fallopian tubes. All of the viscera were in their normal anatomical positions. Except for the above previously described injuries, the internal systems were as follows. Head. No abnormality was noted in the reflected scalp, calvarium, dura, meninges, or the base of the skull. There were no epidural, subdural, or subarachnoid hemorrhages. The 1275 gram brain was symmetrical and had no cortical lesions. There was no uncal grooving or cerebellar tonsillar herniation. The cerebellar vascular system was unremarkable. Serial transverse sections of the cerebral hemispheres, brainstem, and cerebellum were symmetrical and revealed no pre-existing lesions. Neck. There were no other hemorrhages or other abnormalities of the cervical vertebral column, of the soft tissues of the neck, larynx, or trachea. The laryngeal cartilages and the hyoid bone were intact. Cardiovascular system. The 405 gram heart was enlarged. The normal heart weight for a 5'2" adult female ranges from 161 grams to 382 grams, with an average weight of 248 grams. The heart had an otherwise unremarkable epicardial surface with a moderate amount of epicardial fat. The coronary arteries had no evidence of atherosclerotic disease. No thrombi were present in the coronary arteries. You guys have to bear with me. I'm not a doctor, so me trying to read a doctor's notes it's a little challenging. It's whipping me a little bit. It's whooping me up a little bit because he is writing the hell out of this, right? And I don't really know, he's just basically describing his process from beginning to end. Like, this is leaving nothing out. The left ventricular posterior wall thickness was 1.3 centimeters. The interventricular septal thickness was 1.3 centimeters. The right ventricular wall thickness was 0.3 centimeters. The cardiac valves were unremarkable and had the following circumferences: tricuspid 14 centimeters, pulmonary 7.2 centimeters, mitral 9.5 centimeters, aortic 6.1 centimeters. The four heart chambers were unremarkable. The foramen ovale was closed. There was no ventricle septal defects. There were no mural thrombi within the heart chambers. There were no abnormalities of the papillary muscles or chordae tendineae. The myocardium was dark red, brown, and was without evidence of scarring. There were no thrombi within the pulmonary artery. The lining of the aorta had no evidence of atherosclerosis. The major arteries and great veins had normal distributions. Respiratory system. The larynx and trachea were unremarkable. The right and left lungs weighed 235 grams and 185 grams respectively and were partially collapsed due to the hemothoraces. The lung parenchyma had mild anthracosis and was nearly bloodless. The pulmonary arteries, bronchi, and their major branches were unremarkable. There were no distal pulmonary emboli. There were no cystic lesions, nodules, distinct consolidations. Liver system. I'm going to say liver system, okay? The 2,345 gram liver was excessively firm due to fibrosis and also had a parenchyma that was yellow tan and greasy from fatty change. The gallbladder was surgically absent. The remainder of the biliary tract was unremarkable. Hemolymphatics. The 175 gram spleen had smooth capsular surfaces. The dark purple splenic pulp was soft and oozing and obscured the usual follicular and trabecular markings. There was no significant lymphadenopathy. The rib bone marrow was red with an unremarkable trabecular pattern. The next system on our list, except for a visceral pallor due to blood loss, the esophagus, stomach, small bowel, and colon were unremarkable. The appendix was not present. The stomach had 300 grams of content consisting of food. No pills were seen among the stomach contents. Pancreas. The pancreas had pallor and a firm tan lobulated parenchyma. Endocrine system. The thyroid gland had a normal configuration. The adrenal glands were each unremarkable with golden yellow cortices and brown medullas. The pituitary gland was unremarkable. Urinary system. The right and left kidneys weighed 120 and 125 grams respectively. Each kidney had smooth cortical surfaces, had a pale parenchyma due to blood loss, and had otherwise normal regions and papillae. There were no changes in the systems, pelvis, ureters, or bladder. The uterus, fallopian tubes, and ovaries were all surgically absent. Musculoskeletal system. Except for the above noted injuries, all the muscle and axial skeleton were free of any significant abnormalities. Now, that was a mouthful. And right now I give my hats off to doctors because the vocabulary is definitely vocabularying. Like, what? And they know it. It just comes to them like that. Samples of vitreous fluid, pericardial cavity blood, and liver were submitted to the St. Louis University Forensic Toxicology Laboratory for screens and analysis. Screening of the blood was negative for drugs of abuse. No alcohols were detected in the blood. So the summary of everything we just read, guys, that I just delved into and really just picked at my brain to try to read for you guys, I hope I did a good job, was we have an adult female in the early stage of decomposition, multiple 17 stab wounds of the back, chest, and neck, 6 wounds penetrate into the chest cavities, injuries of the upper and lower lobes of the left lung, injuries into the upper and lower lobes of the right lung, perforating injury of the posterior wall of the left atrium of the heart, so she was stabbed in the heart, bilateral hemothoraces. 2 of the wounds passed through the right pleural cavity and penetrate the liver. Not only was the lung struck, the heart was struck, and the liver was struck. 2 stab wounds at the back of the neck at the base of the skull, so also the head was struck. Visceral pallor due to blood loss. Multiple incised wounds of the neck. She had deep wounds transversely across the back of the neck. 7 1/8 inch on the skin surface on the back of her neck. Penetrates up to 3 inches at the end of the spine. Obliquely on the right side of the neck, inferior to the lower jaw. 4 1/4 inches in length on the skin surface. Was produced by at least 2 cutting motions. Penetration of 3 1/4 inches to end at the spine. Multiple parallel superficial wounds right side of the neck. 1 incised wound on the back of the 4th digit of the left hand. Obesity, 255 pounds on a 5'2" frame. Apparently remote surgical absence of appendix, gallbladder, uterus, ovaries, and fallopian tubes. Enlarged heart, hepatitis, and fibrosis of the liver. Toxicology report of the blood came back negative for alcohol and drugs of abuse. The concluding opinion by Jeff Harkey, the doctor, the medical examiner. It is in his opinion that Claudine Blanchard, a 48-year-old white female, died of injuries of the neck, back, chest, and abdomen due to multiple 17 stab wounds and multiple incised wounds. Here go the pictures, right? Here's her name, the date, the height, the weight. Now, you guys can see the manner. They're describing each one of these stab wounds here. They have them all described on the report I just read. They're all in this same area. They all kind of lie in this same area on this side of the back, right? This side of the back, somewhat, just one. But like, it's like this side of the back didn't really even get touched. It's like along this side of the back. What would seem to be the right side of the back, laying down. Right? So we look from the side. There's another one on her side that coordinates with all those other wounds on this side of the back. Right? Quite a bit here. We see one here up closer to the head. Here, like these slices, these slits, one up closer to the head, one kind of in the middle, one like slanted behind the ear. Like it was purposely slanted like that. Like these were just like going straight, right? Straight behind the back of the head. From what I could see, straight behind the back of the head. Straight behind, right? I know I'm not tripping here. Straight. Like this. Like this. And then you have this one, see here, that's kind of like at an angle. So it was just mayhem. Any direction you could. Because this is definitely straight across. Here is definitely straight across, and then lower here, straight across, and then you went at an angle. Looks like behind the ear. And these look like multiple superficial incised wounds, so they're not anything that are like, they're like little scratches, basically. That's what he said, scratches. And then you have stab wounds in the back of the head. Stabbed in the head. Stab wound. 16, stab wound. 17. That's the head. This is the head. Incised wound were kind of like cuts like that. Gruesome when you see it up close, right, guys? Gruesome when you see it up close, ladies and gentlemen. When you notice that she was stabbed in the head. Here. Cut every which way but loose. Right? Right? Shall I zoom in? makes no congruent sense. None. Now we have the hands, and there was one superficial cut. It wasn't anything too deep on the hands, kind of like something that Nick had. Remember, he had a little cut on his hand? Remember that? Suspicious, ain't it? Same place, same finger, huh? Suspicious, ain't it? Yep. And then we have this is the toxicology report. As you guys can see, any type of alcohol that could have been in her blood, it's not in there. Negative. Any type of drugs that could have been in her blood, antidepressants, benzodiazepines, which would include Xanax, and any nerve pills. Yeah, we know about it. Fentanyl, oxycodone, any pain pills, opiates, even down to weed. It wasn't in here. She was clean as a whistle. Or do we not accept the fact? Are we going to ignore the facts and make up our own facts here? I'm not going to try to read the names of all of those because I've already mispronounced enough today throughout this video. But you can see. Negative, 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 negative. Signed, sealed, delivered. These doctors have no reason to try to further an agenda. They don't know what's going on. And this is showing the toxicology report. Found down at home, multiple stab wounds. Blood and liver. Alcohol test. Gives her date of birth, her residence, her next of kin, last known alive, 6/10/2015, by neighbors. Law enforcement agency, Greens County Sheriff's Office, laying in bed. Type of place, descendant's residence. Location, her home. Vehicle involved, no. Fatal injury occurred on job, no. Firearm involved, no. Medical history, diabetes, check. Cancer, check. Endometrial. Others, hyperlipidemia, asthma. Medications collected by the sheriff's office. Description of body, decomposed, liver, interior. Rigor, passing. Body temperature, cool. Liver temperature, 63 degrees. Microenvironment, 71 degrees. Height, 64 inches. Estimated weight, 200. Estimated color, brown. Hazel eyes. Pupils 3 out of 3. Teeth, natural. If natural, condition, poor. Injuries noted, multiple stab and incised wounds to upper back, neck, and right side of torso. Clothing, nightshirt. Valuables, religious medallion on cord. Disposition, left in place. And the last page are the narrative of circumstances surrounding death. Descendant's neighbors called the sheriff's office to report that the descendant and her daughter were missing. Neighbors had seen no activity and had not been able to contact descendant since Wednesday night. A neighbor is reported to have entered the residence through an unlocked window but did not see anyone in the residence. Deputies saw a post on the descendant's Facebook stating that the bitch is dead. A search warrant was obtained and deputies entered the residence to find descendant in bed. Descendant is prone in her bed with covers pulled up to her neck. Covers pulled up to her mid-back. Dried blood is noted over the descendant's back and over her head in a typical sleeping position. There's a small area of blood beneath the descendant's head and shoulders on the bed. Multiple stab wounds are noted to the descendant's upper back and right side of her torso when her nightshirt is lifted. An incised wound is noted to the back and right side of the neck that is several inches in length. Bags are placed over descendants' hands. When covers are placed down, there are apparent blood smears on descendants' right lower back and flank. Body is secured in a body bag for transport to GCMEO for autopsy. Deputies advise that there are additional Facebook posts that indicates that the descendant's daughter was also killed, but she has not been located. What Facebook post ever said Gypsy was unalived? I don't know. Maybe there was one, but I didn't see it. Sometimes police get it wrong. Sometimes police get it wrong. Sometimes they get it wrong. If they weren't there, they get it wrong. Trust me. I know. They just go with what seems most palpable for the news. Most okay, palpable for the news. They're never going to have the 100% correct truth. Sounds palpable. We'll run that. We'll go with that. It sounds palpable. It sounds probable. Let's go with that. So, you see the autopsy report. It basically lines up with everything. It was a horrible manner to die. So, the fact that Gypsy Rose and Nicholas Gojon said in their interrogation that they decided to do it this way because they wanted to get over with quick. Just let her bleed out quickly. And exactly Nicholas's words, right? I read through this report. I read through this autopsy report verbatim. I mean, it was nothing that sounded like it was quick. It was nothing that sounded like it was quick. It was nothing that sounded like it was peaceful. Nothing in that manner. It was the exact opposite. It was the exact opposite. Some of the wounds were 7 inches deep. You penetrated lungs, liver, head, and heart. What? But the autopsy is a good piece of supplemental information to have, but again, your reasoning behind doing it, I don't take it for face value. I take it because it's what you guys wanted to do at the time. It's what you wanted to do at the time. It's how you wanted to fulfill your fantasy at the time. You guys were already playing dress up and certain things of that nature and had these certain fantasies, these certain ideations that were weird, these certain ideations that were concerning. So maybe it was just that. Maybe it was just that. This was bad. This was bad. I feel sorry for the medical examiner. I'm sure that wasn't that medical examiner's first time. And that's the crazy part. People do this every day. That's the crazy part. It took me a while to find it, but I was glad to read it all, to get a better understanding of her body, to get a better understanding of what condition she was in when they found her. There were some things, of course. I'm not a doctor. I'm not a medical examiner. I'm not an expert in post-mortem things. So there were a couple of things that I was reading. And, of course, I don't know exactly where these things are located or the exact measurements. But I feel it's important to read the facts because somebody, I have a doctor that's a subscriber, everybody's from a different walk of life. So everybody might be able to add a little bit to this. Everybody might be able to add a little bit to this. If you might not know what this word means, she might. Or he might. And we can all kind of ratiocinate on that together, guys. If you guys enjoyed this and you like more content like this, true crime, dealing with Gypsy Rose Blanchard, I have a Gypsy Rose Blanchard playlist. Make sure to check that out. And make sure to check out my last 2 videos. I did something on Scott Peterson's documentary. And I also did something on the 7M cult. So make sure to check those out as well. And give me a huge subscribe. This has been Lindsay Unfiltered. And I hope you guys have a great rest of your day.